evening. My name is Linda Pierce. I'm the public health nurse for the town of Westport. Tonight's subject is Opioid Awareness Crisis. In 2019, there were 611 deaths by opioid drugs. In the first 6 months, there were estimated 292 to 363 until the end of the year. Deaths are down 11% by the use of Narcan. What are opioids? Why opioid drugs so addictive and lethal? Does rehab work for opioid addiction? Governor Charlie Baker has built upon the work of his predecessor, Governor Deval Patrick, who created the Opioid Task Force in February of 2015 to combat the opioid crisis, citing opioid addiction and import working groups recommended prevention through education for youths and parents, intervention by providing safe prescriptions taken back programs, and recovery research using data to track addiction and addiction-related deaths. Second, he launched a public awareness campaign in June of 2015 as part of the prevention through education component. Third, Governor Baker directed federal grants to local criminal justice systems and first responders to increase Narcan access. Finally, he introduced legalization of prescription drugs for the first-time users to 3 days or less. The DEA introduces a new plan of attack for opioid crisis in Bristol County. In 2018, there was 2,347 deaths in Massachusetts and Rhode Island. Fentanyl was detected in 83% of the time. As declared by the National Institute on Drug Abuse and the Center for Disease Control and Prevention in the U.S., in the midst of opioid epidemic, it's more important than ever to understand how prescription painkillers, heroin, and other opioid drugs work, why dependence on opioids can develop before you realize it, and which treatment approaches and rehab options are most effective. Opioids is an umbrella term for natural and synthetic painkillers derived from or based on the poppy plant. The related term opiate applies to only medications that use natural opium poppy products. For example, the drug heroin is an opioid. Physicians often prescribe opioids to relieve acute pain from injuries, surgeries, toothaches, or other medical and dental procedures, or to alleviate chronic pain. However, studies show that long-term use of any opioids for chronic pain is ineffective and comes with a risk of addiction. How do they work? When opioid molecules travel through the bloodstream and into the brain, they attach to receptors of the surface of certain cells. The chemicals respond to trigger to the brain's reward system, and the same as the reaction to intense pleasure reinforces acts such as eating, drinking fluids, caring for babies, and having sex, all necessary survival of species. These rewarding and survival-based activities result in the release of dopamine, needed for metabolism and the precursor for norepinephrine and epinephrine, and accounts for 90%. It presents to the central nervous system and located at the basal ganglia in the brain, the reward center. But opioids, like all drugs of abuse, trigger the release of dopamine in excessive amounts, far beyond what is needed to provide pleasure or keep us alive. The brain has signaled something extremely important has taken place and needs to be reported. Symptoms and side effects of opioid abuse. Anyone exposed to opioids would experience excessive dopamine release in the reward center of the brain. However, most people do not become addicted after such exposure. Your risk of dependence is higher if someone in your family has a history of substance abuse. Although most people take prescription painkillers responsibly as prescribed, there has been an increase in non-medical use of prescription opioids in the United States. Signs and symptoms of intoxication. Problematic mental health, behavior, psychological changes such as agitation, poor judgment, or apathy. Signs of an overdose emergency may include nervous system changes, decrease in vital signs, cold and clammy skin, or bluish lips. Opioid use can also be euphoric, and effective can be intense when the drug is administered by routes other than prescribed and recommended. For example, snorting, injecting. For example, the prescription painkillers, OxyContin, can be snorted or injected to enhance the euphoric effects. Unintended consequences of misusing opioid drugs in this way can include serious medical problems, even overdose. Addiction is defined as a compulsion, uncontrollable use of drugs despite vice consequences. Dependence occurs when the body adapts to the presence of the drug, causing withdrawal symptoms when drug is used to reduce or discontinued. Prolonged and increased higher doses of opioid drugs change the brain so that it functions more or less normally when the drug is present and abnormally when the drug is removed. The alteration in the brain results in drug tolerance, the need to take a higher dose. Euphoria is the sensation most opioid users seek, but it's also effective like to diminish with regular opioid use. Prolonged uses change the brain's opioid receptors at a cellular level and protective response against overstimulation. That's why it's said an opioid addict uses the drug in order to feel normal. Many people assume addicts take pleasure in their daily substance abuse, but most people who develop opioid dependence cannot recall the last time their drug was so enjoyable. After a certain point, substance abuse and dependence becomes on its own torture. Symptoms in dependence include taking the drug in larger amounts or over a larger period intended or prescribed, a persistent desire or unsuccessful effects to cut down or control opioid use, an excessive amount of time and efforts getting spent in opioid recovering from the effects of the drug use. And this can happen to anybody. You know, they can have surgeries and now they've been prescribed an opioid and now all of a sudden they become addicted and they need more and more and more. It happens to all walks of life, doctors, lawyers, Indian chiefs, your regular street people. So it's not just people that live out on the street that have these problems. Failure to fulfill obligations at work, school, or home to do their drug abuse. Continuation of opioids despite persistent or recurrent social or personal problems caused by usage. Continued use despite situations could be physically hazardous. Continued use, awareness of potential physical or psychological problems. Taking a large single dose of an opioid can serve as respiratory depression with potential for accidental drug overdose and death. Opioid use is also associated with higher risk of suicide. Withdrawal and relapse. Opioid withdrawal and relapse can be especially challenging. In fact, the fear or experience severe opioid withdrawal symptoms prevent addicts from getting the help they need and deserve to feel normal again. Many of the unique challenges in addressing opioid addiction and because of the addict's vulnerability to relapse and accidental death. There are many places for help. There's a number on my bulletin board of help facilities in Fall River and New Bedford include STAR, Family Health and Care Center on Stanley Street, Stepping Stones in Fall River, and peer groups in New Bedford at St. Luke's Hospital in the White Home. And it really is a very bad epidemic right now, and people need to take this seriously enough to help combat it. And through education, hopefully we'll get there someday. Any questions?
Linda, just to reinforce, in terms of, you mentioned like drug take-back, we have the kiosk at the Westport police station that
Correct.
people can drop off.
Correct, absolutely, absolutely. Or any medication. It doesn't have to be an opioid. It can be, you know, an antibiotic or whatever. But yeah, we do have that facility there. I mean, it really is a big problem, and even little Westport has a big problem with it. And unfortunately, there's been deaths in the town and in the area, and you know, we need to educate and get people to these facilities to get them the help that they need for rehab.
So, you know, the state of Rhode Island passed a law that any distributor of illegal opioids that kill somebody, that distributor can get life in jail.
Absolutely.
And that happened to a Westport.
Yes, it did.
He lived right off of Route 6.
Yes,
so
it
he's going to
did.
spend the rest of his life, I guess, in a Rhode Island jail.
And he sold it to his daughter. So,
Is there any chance that Massachusetts might pass a law like this?
I haven't heard of it as of yet, but you know, hopefully that all the states will get together and we'll all be on the same page, because this crisis has been going on for way too long and it really needs to be through education and rehab, and we just need to do it, because we're killing our youth, we're killing some of our older people. I mean, these are a true, definite addiction, and it's just not, the street drugs. It's just not somebody, scoring some heroin and, shooting up in back alleys and everything. It's all over. And sometimes people go on prescription drugs and then they go further on to getting street drugs because they need that.
Well, the problem these days, of course, is the synthetic opioids, fentanyl.
Yeah.
Which apparently are 100 times more powerful than natural heroin. I mean, Ray
And-
Charles was on natural heroin for 25 years.
Right. And the FDA went and
But
approved fentanyl to be even 4 times the dose. So, I mean, it's like, exactly. So we've got one thing on one hand, and then you've got the FDA approving things, so they need to get together and really do a better job.